Good morning. My name is Patrick Steele, and I'm the CEO of Politico. I'd like to thank you all for joining us virtually for today's program, Battling Information Chaos in a Public Health Crisis. We are in the midst of the worst public health crisis in a century. Scientists, doctors, epidemiologists, and hospital staff are working at an extraordinary pace to understand the coronavirus, and they're getting better at managing the disease and saving lives. However, initially, doctors were trying a number of approaches, sometimes within structured clinical trials, other times on the fly in an emergency room or intensive care unit. The result? Wrong information gets published and disseminated, and accurate information sometimes gets buried. We all want to know the promising findings and the need the experts to share this, but there's a lot of chaos in between. Our conversation today will explore strategies for improving the flow of accurate and timely findings from scientists, doctors, and epidemiologists during a public health crisis. As you follow the discussion, be sure to join the conversation on social media using hashtag #PoliticoHealth. And of course, I'd like to thank our sponsor, Surescripts, for their support in making this event possible. Before we begin our editorial program and welcome Joanne Kennan, our moderator for today's editorial discussion, I'm delighted to sit down for a business conversation with a true leader, Tom Skelton, the CEO of Surescripts. For those of you who are less familiar, Surescripts is an information technology company who since 2001 has been building an industrial strength health information network designed to increase patient safety, lower costs, and improve the quality of care. Tom has been CEO at Surescripts since 2014. His experience spans over 30 years of progressive responsibility running technology and services businesses. Tom, thanks for joining us virtually today.
Happy to be here, Patrick.
So let's get started. Our public health system is obviously getting an enormous amount of attention right now, and for good reason. Today's panel discussion will focus on how the industry and government can better share research information to help inform our response to the pandemic. But what Surescripts does is actually quite different. Your company is really at the forefront of getting providers the data that they need to deliver care. Can you speak to some of the ways that your network has been utilized during this pandemic?
Happy to, Patrick. And as you said, we've got a little different lens on this. We're a healthcare information network. We process about 20 billion transactions a year. So if you think about it this way, we're basically processing 5 transactions per month for every American. And that's quite a bit of volume, and that's the tool that we brought to the pandemic itself. Now, at our core, the Surescripts Network Alliance is what really makes us work. And that is an alliance of pharmacies, electronic health records vendors, PBMs, health plans, long-term care organizations, and of course, health systems from all across the country. A great example of the work that you're trying to talk about here and that we're covering here today is some of the innovation around a tool set that we used called clinical direct messaging, right? And that's one of the ways that the network really stepped up here to help. And what clinical direct messaging is all about is we've got hundreds of thousands of users in our health system partners that rely on this tool each and every day. And they use it for immunization reporting. They use it for transitions of care. They use it for medication transitions. These are the kind of things that they do day in and day out. Now, when the pandemic hit, they also had a different responsibility. The federal government had asked them to do some case reporting every time a COVID patient was dealt with in one of their facilities. And when they received that type of care and had to fill out that form, well, that's just one more administrative burden. So what we did was we met with them, we took a look at our tools and said, you know what, maybe we can repurpose clinical direct messaging, find a way to digitize these forms, and then transfer that information in an automated fashion rather than relying on fax machines and scanning and things like that. And that's what we've done. And we've done it to the effect that there are now millions of these case reports that have been submitted digitally rather than in some archaic way. And I think that results in a better outcome. That's the type of information sharing we like to bring to bear.
And when it comes to public health, how can private firms like Surescript better partner with the government at the federal, state, and local level to disseminate information, especially at a moment like now during a pandemic?
Yeah, that's always one of the challenges, right? I mean, partnering with the federal government is something that we do as part of just running our network. And recently, I had the opportunity to host a fireside chat with Dr. Amy Abernathy of the FDA, an extremely bright woman who understands both the private industry side and the public health side. And we had a lot of discussions there about how we can leverage these private public partnerships to make sure that public health information is getting to the people that need it. And certainly the pandemic highlighted that the FDA, the CDC, et cetera, they needed information that resided with private industry. And so what she stressed was that we need to be able to make sure we give them access to these data sets. And one of the challenges was you can't provide that whole data set. So how do you communicate about this? And what she did, and I thought it was terrific, was she sent us a list of the questions that they were looking for answers to. And by doing that, we were able to turn loose our analytics team on our data and help them get those types of answers. And that resulted in some different outcomes from things that they would normally do. We were providing insights on medication trends and what prescribers were doing so that they can understand what the supply chain looked like for some of the heavier used prescriptions that were being that were going on throughout the country at that time. So that's kind of what it was about. In addition to that, we belong to a group called the Healthcare Leadership Council. This is a group of CEOs from across the spectrum of healthcare that is focused on ensuring that that public-private partnership not only exists, but we have a special initiative that is going on to make sure that in times of a crisis, be it a pandemic or a natural disaster, that the doors are open and that we're all communicating in a way that we can help ensure that every American gets the care that they need.
So, Tom, as a result of this pandemic, there's been enormous urgency, and in fact, I think in some respects, companies and people are open to doing things differently. How has that need to move very quickly into new and innovative areas to respond to the crisis?
Yeah, no, that's absolutely true. I mean, as recently as February, we had basically everybody working in one of our offices, and then all of a sudden, we're all working from home. And why are we working from home? Well, at Surescripts, we set three goals. First goal was keep our team safe. Second goal that we set was make sure that the network remains stable, reliable, secure, so that everybody can continue to count on it. And then third was make sure we stay focused on our strategy, but also make sure that we did the outreach necessary to understand what the federal government needed, what the state governments needed, what local agencies might have needed, and to help pull all of that together. The idea here that you mentioned is absolutely true. I think people are open to change. I think people are open to innovation, and leveraging that is important. And I would say that, frankly, we crossed a lot of chasms as we were going through this. People were open to the types of changes that were being made, and we've been able to see and repurpose technologies to help ensure that information sharing is a key aspect of helping to get us all through this pandemic.
You mentioned your collaboration and dialogue with the FDA. When it comes to public health, how can private firms like Surescripts better partner with governments at all levels to disseminate information, especially now when it's so important?
Yeah, I think a lot of it does come down to that general outreach and making sure that we understand what it is they need. There's a lot of innovation going on. And if you just take a look at some of the core innovations that have occurred, we're all in a situation where we're trying to help one another navigate just something that is outside our range of experiences. And so, what we've tried to do here is stay in touch with folks at the FDA, the CDC, get in touch with state departments of health, and make sure, frankly, that we understood what those needs were. And then we take a look at what tools we have, try to use the existing tools, and where those don't exist, we get creative and we work to put together some new opportunities to move information. In our case, the great thing was we had a lot of data and information that could answer key questions that people had. It was really just a matter of coming to terms and how to get that information to them in a way that it really informed the decisions that they were making.
So when you think about this and look back over the last 9, 10 months since COVID really started, what have been some of the biggest challenges with respect to sharing information during the pandemic?
Yeah, I mean, probably the biggest challenge that we all face in healthcare is we're on a journey here with information sharing. It's not something that's done. It's something that's not as mature as it might be. And so what we've got to do is we've got to work to stay aligned as we're moving forward. And I think that was one of the key challenges here. And the great thing about it from our standpoint is that the breadth of the Surescripts Network Alliance gave us a lot of different lenses that were relevant to what the government and public health were trying to achieve. And it put us in a position that we were able to partner with our existing partners and with the government to make things move forward and to put ourselves in a position and put clinicians in a position where they had the data they needed to make the right decisions.
You're really making sense of that data for the practitioners, right? On the and giving them the tools that they need to implement solutions on the ground.
We are. It's helping to make sure, first of all, that the information they get is timely, that it's accurate, that it's relevant to the care that they're delivering. And then we work with our partners to make sure that it is presented to them in a natural workflow. We've got fabulous clinicians in this country, and the idea that they might have to stop doing one thing to go look at an information sharing screen somewhere else and then come back to a patient interaction, it's just not right. We can do better than that, and we are doing better than that. And that's really what the Surescripts Network Alliance is all about, is making sure that this information informs these decisions in a very natural workflow.
What are some of the, we talked about the need to move urgently, to make decisions quickly, that people are open to change. What are some of the lessons that you as CEO and Surescripts have learned as a result of this pandemic?
Yeah, that's a great lens too. If you think back to the early days of the pandemic, we were all worried about where are we going to get tested, what PPE is available and how do we get that to the right places. And eventually, what became clear was, as we started to get our arms around what those challenges looked like, we then went on to another challenge, which was, we've got a lot of Americans that still need care, a lot of Americans that still need help. How are we going to see them? And so virtual care comes to the forefront. And all of a sudden, we've got platforms that had been growing and had been used that are now, basically dead center. And we're transforming the patient provider experience. And when you do something like that, that's a fabulous opportunity. We saw in March, for example, for a brief period of time, that physician visits fell by 60% over the prior year. That's a huge drop. And to be able to use that virtual platform was fabulous. Now, I tell you another lesson that we learned, and that is that if you've got a secure infrastructure, if you've got a trusted infrastructure, during times of crisis, new users are going to flock to it. They're going to migrate to it. And we've certainly seen that. We've seen 25,000 new people joining our e-prescribing network. That's a fabulous number. And we're now at the point where 60% of all the prescribers in the country are enabled for electronic prescribing for controlled substances. And that means that the fraud, waste, and abuse of these controlled substances is now under a lot more scrutiny because all that data is digitized and we've got better control of it. So these are some of the lessons that we've learned as the innovation has accelerated.
When you think about how to improve and learn and move faster during times like this, you talked about sort of Surescripts and your network. As you think about the healthcare industry more broadly, are there some key lessons that the industry should learn from this moment?
Yeah, I think the pandemic has been unbelievably unique and damaging and painful. And there's no way around that. And nobody's really had time yet to step back and extract all the lessons. But I think what we can say is, there are a few key lessons about innovation and about the needs of public health that I believe are important. First of all, the pandemic has served as an accelerator of innovation. There's no doubt, to your point earlier, people are more creative, more accepting, more willing to change. And so the industry now has momentum. And that's momentum that we have to keep. We can't step back from that. And even when case numbers plateau and they start to decline, we've got to make sure that we stay focused on the agility and the pace of innovation that we demonstrated during what was a very challenging time, because that's what the healthcare deserves. It deserves our very best there. Now, I'd also go on to say, getting data flowing has always been a challenge in healthcare. We've got more flowing than ever. We don't want to walk away and to back away from that. If anything, we want to move on to the next step and enhance that innovation to ensure that the quality of information that we're sharing is better than ever, that it's getting to these clinicians, these providers, these pharmacists in a natural workflow so that it's easily utilized in a patient interaction. And that, frankly, what we do is we work to liberate our clinicians to give the best care possible. I mean, that's what they're there for, and that's what they do best, better than anybody else in the world. That's what this is all about.
Tom, you've worked at, you've run Surescripts for almost 7 years. You've been in and around the industry for 30 years. And we're running short on time, so let's make this the last question. Why are you so, as bad as things are right now, why are you so optimistic about the future?
Yeah, it can be challenging to be optimistic during a pandemic, but when you look at how far we've come in terms of information sharing and the level of engagement between the federal agencies and private industry, if you look at how quickly we adapted to meet the needs of the patient, that agility, that innovation should give us all some comfort as we go forward, that there are ways for us to deal with these types of challenges. And if we stick together, if we work together, the great things are going to happen.
Well, let's end on that high note. I really appreciate your time. Thank you, Tom, and to Surescripts for their partnership on this morning's conversation. And with that, I will hand it over to the expert, Joanne Kennan, for our editorial panel.